Hi, good afternoon and good evening to everyone out there. We've got an amazing turnout for tonight's program. This is Jim Gerson from CareStack. I'm thrilled to be sharing the podium, me briefly for sure, with my close colleague and friend Teresa Duncan, who's going to be your moderator and facilitator tonight. Teresa, you want to say what's up to everybody?
How you doing? I'm excited to be back. It's always a pleasure to be with the CareStack crew.
And our featured speaker, Emmy Sanders, RDH, who's going to speak on hygiene department pain points, discover 4 simple solutions to reduce team fatigue. So you're in the right place. As we get started here, and Emmy, if you wouldn't mind advancing, I'm going to do a quick kind of 90-second introduction on tonight's co-sponsors, because without their involvement, this wouldn't be possible. So there we go. Now, I work for CareStack, but I really want to give a quick moment to plug my co-sponsoring organization tonight, Darby Dental, because without Darby Dental, this program would not be happening, and they're really committed to continuing education. The QR code in front of you is to get a free cybersecurity risk assessment from their Tech Force team. There's no obligation; it's free of charge. And one of the things I think that's unique about Darby, especially in this environment we're all dealing with, for their 80 years of being in the marketplace, they've never had outside reps that come into your office and bug you and interrupt you while you're doing your clinical procedures. They've always been remote, and that's just a better way to provide service and also drive a better value to their dental clients. So I really want to make sure that I mention Darby and thank them for their sponsorship of tonight's program. So Teresa, take it away, please.
All right. So one of the best things about doing these CE webinars is being able to work with friends and friends that I know are going to bring value. So for those of you who are just joining us, this is actually the 6th in a series of 6 management series webinars that we had put on, and we will definitely let you know how to find the other 5. We had some really great topics from leadership to HIPAA and OSHA, which I know are just wonderful, fun things. And then also we did have some transition from manager, from employee to manager, and how to navigate that whole landmine. But tonight we need to talk about hygiene. It is not the least important topic, because not just because it's last, but honestly, this is one of those things that I'm hearing so many questions about. It is super important. Hygiene has become one of the pain points of the industry for sure. So I want to tell you, Emmy Sanders is going to be your host, I guess, or your instructor through this whole thing. And she is known for transforming dental practices with her high energy and her positive approach to coaching. She has expanded her leadership and interpersonal skills for over 30 years, allowing her to increase team performance, refine dental skills, and create a space conducive to learning. Utilizing her unique teaching methods, Emmy's course revitalizes both doctor and hygienist roles through her workshop and real-world case studies that address hygiene department mishaps. Emmy realizes the importance of teamwork and humor as a driving factor in creating a successful practice. She's worked with smaller and intimate offices as well as larger multi-location operations with equal grace and confidence, ready to tackle any and all challenges. Thanks to her chairside clinical and presentation abilities, she's become an official trainer for digital radiography and intraoral imaging, respectively. She has achieved ACE certification, graduated from transformational trainers, holds membership in the Speaking Consulting Network, and has developed a thriving career providing her knowledge and expertise to dental practices while working with international consulting firm Inspired Hygiene. She teaches me something every time we talk about hygiene. I am thrilled to present Emmy.
Hey everybody, I'm Emmy Sanders and I'm super excited to be here with you. So quick disclosure, yes, thank you. I have the opportunity to be here with you all because of CareStack and Darby. So thank you, thank you, thank you. And I am super excited to be here because what I am finding, all of us are finding, is post-COVID, we're having some new problems we haven't had before, right? So today, just real quick, get some learning objectives down for what we're planning on accomplishing. We're going to discover, 4 hygiene profitability, things that you need to know so that we can track your metrics and see how well you guys are overcoming the COVID drama. I've got a fun, exciting way to reduce last minute cancellations in your schedule. You're going to love it. It's called Shake the Flakes. Stay tuned for that. We're going to review some of our patient communication because, when major things happen, we have to ask some different questions, right? If we want to get different answers. So we're going to talk about improving our communication skills so that we can really help our patients with that. And we're going to find 3 awesome ways to improve co-diagnosis with our team as well as our doctors so that we're teeing up treatment for the doctors and doctors are giving it a really nice blessing. So if nobody has any questions so far, let's get going. I'm excited and pumped. All righty. So here's the biggest current pain points that we have, what we're seeing in the hygiene department. Profitability. We noticed that we've lost a lot of providers, so this has affected profitability. Also, last minute cancellations. So for a lot of reasons, COVID being one of them, last minute cancellations has kind of become a really big pain point. And patient communication, we know that is a pain point, trying to clearly identify to patients that, hey, it's safe to come in and to be patients with us in our practice, as well as our team collaboration. So those are kind of the big pain points that are happening right now in the dental practices that we work with all across the United States and Canada. So with that, I just want to go ahead and get the big profit out of the way. Right? It tends to be a somewhat uncomfortable conversation. So let's just talk about it and be done with it. Your house, you have a mortgage and you have power and you have groceries. We all have things that we have to take care of at our own homes. And we have an income that serves those necessities. So that's kind of the same thing with a dental practice, right? Any business is we got to have some profit. You can't just keep spending and not having some income. And what is the profit, right? The profit is that last little bit that we can save for a rainy day. And we all know about rainy days, right? I've had a couple too many rainy days. I'm done with COVID rainy days. So let's talk about some of those benchmarks that you can track in your hygiene department that's going to help you to really understand that profitability portion, right? So I broke it down into 4 simple equations here, 3 times. So just write this down, 3x, 35, 60, and 10. Those are going to be the big numbers you're going to want to remember. We know that 3x is 3 times more then our compensation in the hygiene department is what we need to be producing in order for the hygiene department to be profitable. Now you see that I've got here the backbone in this picture, and that's because I believe that the hygiene department is truly the backbone of the dental practice. A lot of things come through and about and around the hygiene department. These metrics prove it. So back to that 3 times compensation. Let's just rough math it, okay? And I'm going to pick an easy number, right? I went to hygiene school, so I would not have to do math. I do math all the time now. Not fair. Let's pick an easy number. Let's say a hygienist makes $30 an hour. And now that's her total compensation package. That's not just her hourly rate. That's going to be her vacation, her uniform allowance, his paid time off or sick pay or donation to a 401k, everything that is required of a compensation package that a dentist or a business owner provides to a hygienist is that total compensation piece. And we need to be producing 3 times more than that in order for us to be at that first level of profitability. So what's 3 times 30? That'd be $90 an hour. Now I picked a low number, easy math, because, I'm not fantastic with math, but just think in your mind, what is your hourly compensation, like ballpark it? Because if you're making, let's say $40 an hour and you get paid vacation, come up with a guesstimation, if you will, that you're probably about $46 an hour. So then do the math, times 3. And if you don't know these numbers, that's okay. You can track that. It's a very easy way to see if your department is profitable. And that's important, because what happens when we're not profitable? When something like COVID comes along, it's a tougher time for us because we don't have a little bit of savings. We don't have the ability to cover our overhead expenses. And we also don't have the ability for us to keep working. And if you're anything like me, I know you entered into this profession because you wanted to love and take great care of patients. So 3X, that's compensation. Got to be 3 times more than your total compensation. Let's talk about perio percentage. We know, you guys know this, 50 to 75% of the adult patient has some form of periodontal disease. And if that's true, work with me here, if that's true, would you agree that at least 35% of the hygiene services that are happening in your dental office are at least perio-related services? So think that through. If we know an 1110 is a healthy adult prophy and we're doing therapies and periodontal maintenances, and we do the math, 35% needs to be one of these periodontal codes. So that'd be 4341, 4342, or 4910. So we want that perio percentage, about 35% of what's happening in hygiene, to be perio-related services. Also, we need to know that 60% of our doctor's schedule is scheduled out of hygiene. So the way that you would track that is you would see what's the recommended treatment by XYZ hygienist, and of that recommended treatment, what gets scheduled. And you want at least 60% of the doctor's schedule coming out of hygiene. That is something that is really a wonderful benchmark to see just how well your hygiene department is doing. Now let's talk about open time. If you don't know what open time is, I'll take just a quick second and describe it to you. Open time is the amount of time in the hygiene column only, not in the operative column, only in the hygiene column. It's the amount of time that there's not a patient's butt sitting in the chair, okay? Now, a lot of people would say, if I say, how much open time, that means no patient in the schedule in hygiene, how much open time do you think you would want? A lot of our administrators, right, or office managers, they're going to say 0. Well, actually, no, that's not true. If it's so tight, it's 0. That means if Mrs. Smith calls because she needs to cancel an appointment, she's got a funeral to go to. I mean, we know life happens. If she has a funeral to go to, then we don't really have anywhere to put her because the schedule's so full. So I call that schedule kind of Grand Central Station. Stay tuned for that because we're going to talk more about Grand Central Station here in a little bit. Here's what we do know. When it comes to open time, the amount of time that you don't want a patient sitting in the chair, and it's not that you don't want, but you want it to be nice and easy for scheduling purposes. There's a sweet spot, and that's 10%. So that's on average 10% open time, and there's a super easy way to calculate that. You calculate how many hygiene hours you have available to serve patients, and you go backwards. So this is not something you track forward. This is only something you track for yesterday or last week. It's not today or next or tomorrow or next week. You only track backwards. So you calculate how many hours of hygiene time you have available, how many of that was empty. Do the math, and it should be right around that sweet spot of 10%. So we've got 3 times more than our compensation is what we need to produce. 35% perio-related services. 60% of the doctor's dentistry needs to be teed up and scheduled out of my operatory, and 10% open time. All right, so let's move on. I want to talk to you a little bit more about perio because I love perio. A lot of people don't, but it can be simple and easy and fun. So here's what I want you to do. I want you to go to, just write this down for now or get your phone out and take a picture of it. inspiredhygiene.com/perio tool. what that's going to do, that's going to take you to our Perio calculator tool. You just enter in your name, what your position is, where you work, and your email, and it will come, and you can run your report. Here's the answers. Print your production by procedure report. Plug in these numbers. You're only going to calculate 43.41, 43.42, 49.10 and adult pro fee. And then that's going to spit out the answer. And you can see here on the Perio percentage triangle that if you're between that 0 to 20%, this is a wonderful opportunity. You've got the great chance of doing something different about raising that. So now here's another thing you can do. Hang tight. For you younger, more savvy people, here's a QR code. You can just take your phone, highlight it on that QR code, click that, and it will take you directly to that Perio calculator tool. You can download it right there to your phone. So I hope that's helpful. I'll give you just another second, and then we're going to move on to our next subject. Here we go. So let's talk about those last minute cancellations. Remember earlier when I talked to you about Grand Central Station? That means you've got so many patients. Your practice feels like it's Grand Central Station. You almost never have any openings. There's tons and tons of patients coming. Or then there's the opposite. What's the opposite? Ghost town, right? Nobody's on the schedule. You got lots of open time. So what we're finding right now in our current market and timing post-COVID is we're finding that it's a lot of Grand Central Station, right? And why is that? That's because patients who fell off of our calendar when we were during COVID may still not be all rescheduled and back in to see the dentist or the hygienist. We're also finding that last minute cancellations are happening because people are still a little fearful. I have noticed, I think you guys probably have too, any little sniffle and they're like, I'm not coming. And thank you, I don't want your COVID. But yeah, it makes a difference in our schedule. So I want to talk to you about those last minute cancellations. Those are the patients who tell you that they're coming and then they don't come or call the morning of or maybe the day before, because that's what's really kind of tearing up our schedule. Now, identify those patients as flaky patients. Now, even before COVID, we had flaky patients. Flaky patients were the ones that always told me they were going to come, and then they might not come. And usually I could look on the schedule and say, oh, I know him. He's not going to keep his appointment. He never does. That's a flaky patient. A flaky patient is not the patient that loves you and always comes early and brings you fresh baked cookies and is fabulous. That's not a flaky patient. Flaky patient is the patient that tells you they're going to come and then they don't. They might call you. They might leave you a message on the voicemail overnight, or they might just not show up at all. So let's talk about how we can help those flaky patients keep their appointment. Because here's what I do know. If I can look on my schedule and know who are my flaky patients and the probability that they're not going to come, and remember, I've got more patients that really do want to come because right now I'm experiencing this Grand Central Station. So if I knew he wasn't coming, I could fill it with someone else. So you want to do something called shake the flakes. Shake the flakes. Okay. So here we go. Think about this. We're going to shake the flakes. We're going to shake those flaky patients right out of the schedule. What that's going to do is create some openings to allow us to serve the patients that do want to come to their appointment. So start here. I'm going to give it to you really quickly. And if you want this in a more detailed format, email me. I am happy to email it right back to you. But it's pretty simple. I think you guys can do it on your own. Go ahead and start calling those flaky patients out 3 weeks. And I want you to leave a voicemail, because typically we leave a voicemail, right? They don't ever answer. You're going to leave a voicemail, and it's going to sound something like this. Hey, Mrs. Smith, this is Emmy. I am calling from Dr. Smith's office, and I'm calling about your upcoming appointment that you have on June the 15th. Will you call me back? My number is. Then next week, I want you to document this week that you've made that shaky flake call 1. Then next week, if the flake has not called you back, I want you to call flaky patient again. And this second time, I want you to say, with a little bit more urgency, still very pleasant and kind, but a little bit more urgent, and say, hey, Mrs. Smith, this is Emmy, and I left you a message one day last week. I'm calling about your upcoming appointment. Will you please call me back? My number is, and tell her that. You can even go another step further and say, I'd like to hear back from you by the end of this week. And then if that document that you've left shaky flake call number 2, and then that patient doesn't call you back, then it's time for the third week, which is the third call, which is the week of their appointment, right? So now we're really urgent. I got to talk to you. So here's how that voicemail might be. Hey, Mrs. Smith, I've left you 2 voicemails about your upcoming appointment on Wednesday. I've not heard back from you. If I don't hear back from you by the end of the business day today, I'm going to have to release your appointment to another patient. Will you call me back? My number is, right? And document that you've done that. And then at the end of the day, or maybe the following morning, because let's give them some courtesy, they may leave you a voicemail at night. If you haven't heard from them, release the appointment and document you've done that. Because with 3 successful voicemail messages and documented voicemail messages, go ahead and release the appointment, and let's get in your schedule a patient that wants to be served by you. So that's shaking the flakes out of your schedule. And I'm confident you guys can do that. It's a super easy way to really close down those last minute cancellations right away. All right, so let's move on. I want to talk quickly about patient communication. I want to honor everybody's time, so we're out of here by 7 today, and we are right on time. I'm tickled pink about that. So let's talk about patient communication. I'm going to give you 3 quick tips about clear, concise statements that we want to make with our patients. And I'll give you a couple of examples of this. Sometimes when we're with patients and we're talking to them about their care, we might get a little long-winded. I've been known to do that. I want to talk way too much, when really we need to just keep it short, sweet, and to the point. So as a hygienist, I'm going to speak to you from a hygienist perspective. I would tell a patient simply, you have an active infection, right? So that is super. I just told them they had periodontal disease, and it was a super simple, short, clear statement. You have periodontal disease. I'm concerned because I know people who have this active periodontal infection have an elevated risk of cardiovascular event and stroke. It's in your best interest that you treat that active periodontal disease with periodontal therapy. Tell me what questions you have. And then this is a great time to practice that second part of our communication, right? Is the active listening. So when we deliver a message, we'll have to allow the recipient the opportunity to come back to us with some active listening. And based on what we have discovered in dentistry is it's typically one of 3 things that a patient is going to bring up next when you say something like that. It's either going to be fear, time, or money. And so when you can figure out, okay, money is this patient's obstacle, then you can figure out, hey, I've got some great ways to help you find a way to fit this in your budget, right? Short, clear statements. Now, active listening is actually a multitude of things. It's watching their body language. Sometimes when you see a patient like so, I mean, what are they telling you? They've had a really bad day, or they're not buying into what you're telling them about their disease. So watch for the body language. Is going to be a wonderful way to see kind of where you are on their radar. Also, look for their eyes. If they're looking in other places, that's a great signal that they're not very interested, right? And if they're looking directly at you and hanging on your every word, what does that tell you? So that active listening is more than just listening to the words. It's watching their body language and clearly identifying that you've delivered your message, answer their question, but here's the goal. When I deliver a message to someone, I want them to be able to duplicate that message back to me. And that's the third part of this easy patient communication. You need to make sure that they can duplicate back to you what you said. And if you have those clear statements, active listening, watch their body language, listen for what they're asking you in a roundabout way, and then ask them at the end a closing statement, something that would be like, I've shared a lot of information with you today. What questions or concerns do you have for me that'll help you get this scheduled? So by asking that, what question do you have? I am asking for them, or I've even said to a patient, can you repeat back to me what you heard? And it's okay, right? That's a very mature communication style. It's hard to do at first, but you're not talking down to them, because we're not in the shame blame game, right? We're all here to serve our patients, but the important part of this is that we deliver a clear message that they're able to comprehend and hear, and we're able to hear back from them that they've received the message. So that's patient communication. Now, I want to give you some really awesome, cool phrases that we at Inspired Hygiene love to use all the time. And these are great for the hygiene department because I'm a hygienist, but you can also utilize them in other areas of your practice. So for example, you have a little bleeding. Well, I've heard that. You've got a little cavity. You've got a little bleeding. Okay. The honest truth is you don't have a little bleeding. You either have bleeding or you don't. It's kind of like being pregnant. You are pregnant or you aren't, right? So instead, let's take the word little out of that phrase, and instead we can invite in something like light, moderate, or severe. And then I found, instead of saying I found a cavity, what if you said something like you have a cavity? Because if I found it, I'm claiming ownership of that. And if you have it, then it's yours. You walked in the door with it. I'm just telling you about it, right? And so think from a dentist's perspective too. When a dentist comes in the room, he may say something like, what are your findings today? Like, don't say that. Instead, tell me about today's appointment, right? And then another one that I've been known to say in the past, and I have since changed that, is, oh, we just took the CE course and I learned, yeah, that was not in my best interest. Instead, you might want to say something like, we now know, or we have discovered, or most of our patients can identify that, da, da, da. Some other stop saying is it didn't work, right? Maybe you would say something like, we didn't get the results we had hoped. You could say that more in an emotional way, like it's in your best interest, because you can tell that's just a softer, more delicate message instead of you need, right? Because my mama said that to me, you need to do your homework. Yeah, I need to. When she could have said, it's in your best interest for you to do your homework. And they're both right, right? So here's just a small list. Get your phone out, take a quick picture if you'd like to have that. If you don't have your phone with you, email me again at the end of this. Tell me what you're requesting, and I'm more than happy to send it to you. So these are some great ways to just change your vernacular, because I've found that when we up-level how we communicate with our patients, we'll get some different answers. Let me also share with you about medical history really quickly. For years, we've always said, have you had any changes in your medical history? And patients say, no. And then the doctor will come in, oh yeah, I had a heart attack last week. Like, you could have told me that. I asked. But what it was then that I decided, if I want a different answer, I've got to ask a different question. So I want to share with you a question, a way that I phrase it that has been super helpful to get more information out of the patient. And that is, hey, tell me about your last trip to your medical doctor. And that's a more open-ended question, and it's a great way to communicate with patients. They're surprised to hear it because, believe it or not, we've trained them. Any changes in your medical history? We've trained them, and they're accustomed to hearing what we typically always ask. So think about how you could phrase things a little differently. Okay, now I want to talk about some team calibration. This is a great way to really get everybody on your team so that you can co-diagnose and get everybody speaking the same language so that the patient is getting a message clearly from every member on the team. One of the absolute best ways to do this is to invest some time. So doctors, I hope you hear me when I say let's invest some time into some team meetings where you pick a patient, go through their digital imagery, right? So their radiographs, tell each other, what do you see? What do you see at the floor of a prep? Because, we hygienists, we didn't ever learn about how the bottom of a prep looks like. We also may not know the why you recommend an only versus a crown. So here's the 3 things that I want you to think about when you are getting calibrated with your team so you're speaking the same language, is you got to give your team permission. It's okay for you to tee up the treatment. And then you want to give them the knowledge. So having this nice little team meeting here where you're all learning together, looking at images, because I promise you, if you pull up, let's say, an image of tooth number 14 occlusal surface with a MOD amalgam and a mesial marginal ridge fracture, you might get your teammates to have a different diagnosis or treatment plan than you, the doctor, right? So it's a great way to get everybody focusing the same way, thinking the same way, and then think about how you want to explain that. So first of all, let's give the team members permission to talk dentistry and to take images and tee up treatment for the doctors. And then we want to give each other the knowledge by sharing that knowledge. And it's okay if we don't know. There have been times where I didn't know, and I had to just go back there and say, okay, tell me why this tooth required a buildup in crown when last week you saw this lady and it didn't require a buildup in crown. I need to know the why so that as a hygienist, I can speak more eloquently to the patient and support your dentistry. And then the third thing is, and this is the toughie, is the accountability piece. We want to hold each other accountable, right? Because we're in this profession because we want to serve our patients to the greatest of our abilities. And if we do that, we do it really, really well, we're going to hold each other accountable, because showing them what they have, telling them about the solutions that are available, teeing that up for a doctor. I mean, that's in the patient's best interest, right? So holding each other accountable. And how would you do that? So just like I took a picture of this too. That's a doctor. It was like this last week, and now this patient, similar. Why is it a different treatment plan? And I learned something new that I didn't know, but I was holding him accountable for what we had agreed for how we're going to serve our patients. Okay, man, I feel like we have covered a ton of content. I have just gone on and on and on and didn't take a breath. Are there any questions that you guys want to just hit on really quickly?
I mean, take a breath. That's hard to go for 40 minutes. You go,
I'm
Teresa.
sorry, I just did not even. I just kept going.
No, it was great.
No, it's great.
Great information. I was taking a few notes, and I have a couple of questions. But there was one question saying, Wendy was asking, are we not including the gingivitis code 4346 under perio?
Yeah. That's an awesome question. Thank you so much for asking that question. And here's why. So, we have healthy gingivitis, then periodontal disease. What's the difference in gingivitis and periodontal disease? It's bone loss, right? So what do we know? Once a patient has perio, they can get back to healthy with a reduced periodontium, but they can't get back to just straight up healthy, right? What do we know about gingivitis? It's only in the tissue. It's not affected the bone. So if we catch it early, treat it well, we can do that 4346, move that gingivitis patient back to a healthy patient. That's an awesome question. Thank you for asking that.
I love it. Well, and one other question that does come up is what happens, and this comes up in my insurance classes, what do we do when we have a patient in the chair and it's going to be a 4346, not the 1110 that they thought they were coming in for? How do you smooth that over with them?
That's really tough, right?
Mm-hmm.
Because we as healthcare providers, we want to do for the patient what they think that they're coming to have done. But are we doing it at a detriment if we're trying to rush and hurry up and get that done? So first, let's talk about the conversation part. You have an active infection. It's in your best interest that we treat that with gingivitis therapy. And here's the greatest news of all. We know that when we treat this early, it doesn't advance to periodontal disease, and we can get you back to a nice, healthy state. Now, I know I've shared a lot of information with you today, and you probably weren't prepared to do that today. And I'm aware of the time. If we can, I would love to be able to get that accomplished. Do you mind if I check with our team or have someone come in and discuss the finances with you? But you just need to tell them it's their disease, and don't shortcut yourself. It's okay if they came for an 1110 and we see they need something different. It's okay to invite them to come back.
Okay.
Don't get yourself. Did I answer your question well enough, Teresa?
Yeah, absolutely. Because, the problem is the providers, hygienists and dentists, they know that the care has changed, but telling the patient and then having the patient say, but I get 2 cleanings a year, come back at them. I understand that, but hello, patient, like you said, you have something going on. I would like to take care of that right now. I love that, Emmy. Okay. You answered it great. And those were the questions I have so far. If there's any other questions, we will have time at the end for Q&A. So go ahead and pop those in chat. Go ahead, Emmy, take it over.
Okay, so let's review our big pain points. When we're talking about profitability, remember the benchmarks that you can use to track your success. It's 3 times your total compensation. You need to be producing 3 times more than your total compensation package. That's a benchmark. You also need to 35% perio-related services, not all 1110s, because we know that not all patients have healthy gingiva. Then 60% of your dentistry needs to be teed up and scheduled in the operatory out of our hygiene operatory. So teeing up that treatment and getting really calibrated with your dentist so that basically you're setting it up for success. And if you'll do number 4, that team calibration, you'll improve that ability, right? So 60% needs to be scheduled out of hygiene, and then 10% open time. And remember, open time is only in the past. It's not forward, it's only in the past. So that's the profitability metrics that you guys can track to see how successful you're doing. And remember, think of metrics as juggling. The objective is to keep all the balls in the air. They're not all going to be high the same month. You think they will, but they won't. Some are going to be lower each month. So the goal is just keep focusing and working, keeping all the balls in the air and none on the ground. And then last minute cancellations. So those people that they no show or last minute cancel, identifying your flaky patients. You typically know who they're going to be, especially our seasoned admin department. They know very well who's going to no show. And then also if a patient calls on the phone and just says, hey, I'm not going to be able to make the appointment, go ahead and re-ask. It never hurts to re-ask. Hey, it's really hard to get an appointment with Teresa. She's the very best. Her next available would not be until July 17th. Are you sure you wouldn't be able to keep today's appointment? Because here's what I do know. If you don't ask, the answer is always no. So last minute cancellations. And then patient communication. We want to make sure that we're using clear, concise, easy phrases. We want to take out those minimizing words like little. We want to be very direct, and it's okay because it's their disease. It's not my disease, right? It's their disease, and they walked in the door with it. Your job is to just tell them what you see today. And I know that providers who have served patients a long period of time, they're like, but I can't tell her. I've been seeing her 16 years. I can't tell her that all of a sudden today she's got periodontal disease. Well, yeah, actually you can. And let me show you how. Are you ready? You're going to say, Mrs. Smith, do you remember last year when I talked to you about your home care habits? Look right here. I even documented it in your chart note. Do you remember when I recommended you get a power brush? And do you remember when I talked to you about maybe coming in more frequently or flossing more? Well, we've done all those things and we're not getting the results we had hoped. It's time for us to do something different to treat this active infection. And that's gingivitis therapy or periodontal therapy, whatever your answer is. So you can do it. I believe you. If I can do it, you can do it. And then team calibration, get everybody on the same, using the same words. Go ahead and strike out SRP. I heard a perfect example. I'm not even sure who I was on the phone with today. But the hygienist said periodontal therapy, the doctor said SRP, and the admin person said scaling. So total confusion for the patient, right? They heard 3 different things. So
yeah, SRP is like a buzzword. People don't know what that is. They're intimidated. They feel stupid for asking too.
And they feel stupid for asking. It's like calculus and tartar. It's the same thing.
Right.
Yeah. So just get everybody calibrated so you're speaking the same language. That's critical. All righty. So now, do I have another minute to do
go for it. It's your world. We're just living it today.
Okay. And I'm going to honor your time because I know people enjoy, being with their family.
No, we can hold them hostage for a few more minutes, right, Teresa?
Absolutely.
Okay, good. Here's what I want everybody that's there listening. I want you to write this down based on what we've discussed here tonight. And I'll tell you what, why don't you do this? Write it in the chat. Based on what we've discussed today, what will you plan to do differently tomorrow? Oh, got a hand raised.
Oh,
yeah.
See, raising a hand, I can unmute them, but that's really difficult. So if you want to write what you want to do differently, you can do it in chat and you can make it just for Emmy to see.
Yeah,
Yeah.
I want to know
If
what
I try to unmute your line,
Yeah.
Oh, we got some more raised
Yes.
hands.
Look at that.
Yeah.
Educate the patient, Irene says. That's great. Word bleeding differently.
Yes.
I love that. Call patients that usually no show or cancel last minute. Yeah, because you know who those flakes are.
Oh,
And
no. Yeah.
us front
Shake the
office
flakes.
people,
I love that.
we know. No minimizing treatment. That's fantastic. Team calibration and try to gently encourage the front office to call. Oh, just going by. Gently encourage the front office to call our bad patients. Yeah, because we know who they are. Dropping the word little from the vocabulary. Stop taking ownership of the patient's disease. Fantastic. Use proper language. I will no longer be a dental hygienist, but she's a periotherapist. I love it. Love it.
I love that.
Oh, start deflaking my schedule. That's great. Cheryl loved your verbiage for updating medical history. And I thought that was fantastic. Getting everybody on the same page, changing SPR words, SRP, SPR, all of that.
Yeah.
Replacing some of my wording with your new phrases. That's what Vion was saying I think that's what she meant to say when she raised her hands. And then last appointment notes and reintroducing disease. Talk about that with the patient. That's fantastic. Pass on your flaky patient pathway to our front office staff. I love it.
I'm more than
us
happy
handle
to do that.
Let
Amy,
us handle it.
you got to trademark that expression and make T-shirt to say "shake the flakes." That's like,
Yeah.
but you know, a dandruff company might pay you millions of dollars for that, for like their dandruff campaign. Who knows?
There you go. Shake the
But
flakes.
I like the dental application's great.
Yeah, we're not in it for the money. We're in it for saving lives.
This is fantastic, though. What a great response to all of that. It really sounds
thank you
like,
everybody for sharing.
that's great.
That's really good. And then I've got one more.
Yeah.
So another power question. If we were together 1 year from today, what will have happened in your hygiene department for you to feel really happy with your progress? Right? So if you decided to de-shake or deflake your schedule, how are you going to know how that progress looks? Just think about that. And you can write it down. You can type it in the chat, whatever you prefer. You can send it to me on an email. I love to talk to anybody.
Mm-hmm. Oh, I think you hit something. No more flakes in the schedule, less cancellations. Vanessa says we tell the patients you have a bone infection. I like that.
Oh, Vanessa, may I use that? Thank you.
They're going to increase. I'm hearing they're going to increase perio percentage and calculating the percentage of production. They're going to take more of an interest in that. Increased production means increased pay opportunity. Absolutely. TOTS training, I think, is where she got that verbiage. And I do have one question from Ontario, but we'll wait until everybody's done putting in their information here. I just don't want that person to think I'm ignoring their question. I'm not. Janet wants to see increased production and decreased no-show rates. Sounds good to me.
Hey, I love it. And remember, every time that you can shake a flake out of your schedule and put another patient in your schedule, you have the opportunity to save another person's life, right? So hopefully we'll come back and do another course on how periodontal disease really attributes to your overall health. It's amazing. And this is not a new book. It came out probably 6 weeks ago, but I'll just share this as just an extra added bonus because I've already read it. And then they sent me a hard copy today, but this is Healthy Heart, Healthy Brain. It's written by Dr. Bradley Bale and Amy Doneen, and they are amazing. They are a cardiologist that have the Stroke and Heart Attack Prevention Center in Spokane, Washington. They also wrote the book, Beat the Heart Attack Gene, but the whole 10th chapter, I even bookmarked it, I think. The whole 10th chapter is about us, dentistry, and how healthy gums and teeth help you live longer.
Love it.
Okay. So I hope that if nothing else, I'll leave you with a little bit of inspiration that Hey, we're in the business of saving lives, and I am honored to be able to save patients' lives right alongside of each and every one of you fantastic professionals. Keep going.
Emmy, somebody wanted to know the name of the book again. Healthy Minds, Healthy Heart,
Healthy
Healthy
heart,
Brain.
healthy brain.
Okay. I'm going to type that into everybody.
Yeah.
And then you'll love this. Charla is saying, we plan to shake those flakes. Yeah, you hit something.
Yeah. Okay, so write down my email. If you need some additional support with your shaky flaky, I can do that. My email is Sanders, my last name, rdh@gmail.com.
Just go forward one more slide, Emmy. I put it on there for you.
Oh, you did?
Everybody, yep, I want everybody to be able to see it. I hope it's there. Is it not there?
You know, she might have to refresh her deck.
Oh, okay. Well,
Google.
you know what? Let me go ahead then and put that into the chat.
Okay,
that
that'd be
people have
great.
it. Yep. Sorry about that. I thought for sure it would just show up. All right. There you go. Well, and I did want to ask you that question from the provider in Ontario. Let me go back here. In Ontario, the Professional College of Dental Hygienists does not like to use the term root planing, as research has suggested that using a metal instrument to try to smooth the root of a tooth can be more damaging. They are supporting more use of scaling with piezoelectric or Cavitron instrumentation. Should I use scaling in my discussion with 9-month recare patients and 3-month perio interval patients as well?
Okay, perfect question. Perfect. Okay, so you're going to get a little extra bonus content here. It wasn't even on your CE. In a nutshell, an active infection is caused by two things. What are they? The host, that would be me, I'm the host, and the bacteria. So when the bacteria comes in, it starts a party of infection. The only way to kill an infection is to kill the bacteria. I mean, we could kill the host, but let's not. Kill this bacteria. The only way to kill that bacteria is to utilize ultrasonics, piezo technology, either one, right? Magnetostrictive or piezo, your choice, and disturb that biofilm, because that biofilm is where the bacteria lives. Once you've killed the bacteria, then the body, the host, has the opportunity to get better. So yes, I totally understand how they don't want to scale, because remember, scaling is like taking our instrument and going all down in those pockets, right? We were root planing. We were taking that whole external layer off of the tooth. And that's kind of old and passe. So the new way that is more effective and more kind, and it's easier for us clinicians as well, is to disturb that biofilm by killing that bad bacteria with an ultrasonic of some type, magnetostrictive or piezo. I hope that was helpful. I love disease.
But I really agree with your advice to not kill the host. That's usually not.
Let's not kill the host.
All right. Well, Emmy, thank you so much. I don't see any more questions, just so much interaction, but I don't see any more questions. So Jim, what do you have to say about the CE code that's in hot demand here?
Yeah, well, first of all, I want to thank Teresa and Emmy for tonight's program. Just so many great insights. I every time I hear "shake the flag," I'm gonna giggle to myself. So you've got to trademark that. Thank you. And Teresa, we've done 6 sessions now, so this is like amazing 9-month project we were on together. And I want to thank you on behalf of CareStack and Darby for leading this amazing initiative to really raise the collective abilities of everybody in the dental practice. Thank you so much. Appreciate it.
My pleasure. Thank you.
If you want to learn more about our upcoming CE courses, because we're doing CE all the time, you can join the CareStack Champions Facebook group. Not big believers in blasting people with 50 emails. So if you want to opt in and you want to learn about what we're doing education-wise for hygiene and other related topics, the CareStack Champions Facebook group is the place to go. Ladies, thank you so much for a wonderful evening. Really appreciate it. Stay safe out there, everyone. Thanks, and have a great night. Really appreciate it.
Good evening.
Take care.